Hello, my name is Edgar Leon. I go to Merced College, and today I want to talk about the norovirus. The title of my presentation is called Norovirus, a Threat to Medical Facilities. Usually the first thing that comes to your head is, well, what is norovirus? The norovirus is a viral infection that mainly affects the digestive system. It is actually a common bug, and there are various ways to contract it. In fact, it has a more recognizable name. Do you think you know what it is? Well, the answer to that question is a stomach bug or stomach virus. Well, why is it important? It is important to understand not only as an individual, but also from a medical perspective, because there actually is no cure to the norovirus. No person is immune to it. It is highly contagious, meaning it is very easy to pass on and very easy to contract. In fact, there are about 21 million cases each year in the United States alone. One of the most common outbreaks occur in healthcare facilities and food service agencies. The norovirus can be specifically serious to special groups. These groups include children, elderly, and people that are immune compromised. For infants and the elderly, it's about the same reason, and that is because of these two key symptoms, vomiting and diarrhea, which can cause dehydration. Dehydration is especially dangerous to people of these age groups because they have a difficulty to compensate for the loss of hydration, which can become life-threatening. So that's when they're going to require specialized therapy and treatment and oftentimes be admitted into the hospital. This also includes immunocompromised infants, children, and the elderly. Usually this pertains to people that have autoimmune disorders, as well as patients going through HIV and AIDS treatments, and people just living with HIV and AIDS, patients receiving chemotherapy as a result of cancer or other diseases requiring some sort of immunotherapy. And lastly, people who have recently had major surgery. This includes organ transplants. Usually when you have a major surgery like that, you're given immunosuppressants which can exacerbate the symptoms and can cause a delayed response in your immune system to the virus. In fact, sometimes it won't even respond at all, which can be very, very deadly. Now, for the morphology of the virus, it is actually a single-stranded RNA. The most common type of the norovirus, at least the most common human type, has been identified as the NOVGI2.4. It measures between 27 and 40 nanometers, and it is part of the Calliciviridae family. This virus actually contains approximately 90 dimers. A dimer is actually these tree things that surround the shell of the virus. It is approximated to have about 90 of those. Some common signs and symptoms of the norovirus are nausea, vomiting, diarrhea, and fever. Now, if you look at this just from far away, you can tell these are very common symptoms for almost every viral infection, so it's actually common to be misdiagnosed. It isn't until you reach the later stage where you actually show symptoms of dehydration where a physician or a healthcare provider is going to determine whether or not you actually have the norovirus, which is usually done through testing. This can be testing through blood or most commonly a stool sample. With a stool sample, it can be done very accurately and very rapidly, so they're the most common type of testing done in hospitals, specifically in ERs. In serious cases, again, dehydration can occur, and in specialty groups, it's going to require admittance to the hospital. Now, for the treatment, this virus actually does not have a cure. In fact, treatment for the virus is usually symptom focus-based treatments. So if you are vomiting or you have nausea, your healthcare provider is going to prescribe you some antiemetics, which is essentially going to reverse the effects of nausea and hopefully prevent you from actually vomiting. You may also be prescribed or just given over-the-counter non-steroidal anti-inflammatory drugs. These drugs include ibuprofen and Tylenol. These drugs are used to treat body soreness, body aches, as well as fever, which is an associated symptom of the norovirus. In serious cases, you may require intravenous fluid replacement and antiviral drugs. For intravenous fluid replacement, this will require admittance to the hospital. A nurse will usually poke you in a vein to give you these fluids, which is going to require additional stay at the hospital, if not at the nursing home. And the reason why you're not given antiviral drugs right away is because it actually does affect your body. It is very heavy on your body and can, in fact, cause some organ damage. In most cases, you actually do not need to stay in the hospital, but you should avoid large group gatherings, especially around food. This includes restaurants and parties. For prevention, you can see in healthcare facilities there is a more extensive list taken to prevent the norovirus outbreak. At home, you're often just asked to disinfect with daily cleaners that kill bacteria and viruses. This is products like Lysol and Clorox. It is important to understand that you need to clean common areas specifically that are going to be surrounded by food, like countertops, perhaps even sinks. And the reason why I say Lysol and Clorox is because they have virucide, which is important in order to kill viruses like the norovirus. You will also be very much recommended to wash your hands frequently, especially when you're touching food or touching really anything. You want to avoid touching your eyes and your mouth frequently as well. Now, for healthcare facilities, in particular times when there is an outbreak of really any virus, there's going to be scheduled times to disinfect by frequently cleaning throughout the day. This usually will be done by custodial workers. Healthcare providers will be asked to wash their hands frequently. All personnel will be recommended to avoid touching their eyes and mouth as well. And it is also important for healthcare professionals to don PPE when handling isolated patient and belongings such as a lunch tray. Now, because it is a highly contagious virus, people that are diagnosed in a nursing home are going to be isolated to prevent an outbreak. Usually when one person tests positive for the norovirus, it's pretty likely that there's 3 people that also have it. For the healthcare provider, really anybody that works in a special area where an outbreak could occur, such as a restaurant or nursing home or any healthcare facility, you will be asked not to go to work if you are sick. It is also important to follow isolation guidelines such as reducing patient contact with any non-essential persons. This in a healthcare facility would include a situation where if there were an outbreak, usually it will be done in a ward, which they will then isolate that ward, and the healthcare provider will be asked not to see patients in other wards to reduce the chance of spreading it in that facility. For statistics, about 51% of norovirus deaths from dehydration due to diarrhea are 75 and older. This study is based on women who were white and admitted to a nursing home. And in cases actually peak between November and April. This is actually very common. This also occurs for the regular influenza virus. The global mortality rate is actually 0.0003, but it does have a success or survival rate of 99.0007. In conclusion, the norovirus is a gastrointestinal viral infection that presents with typical gastric symptoms. This includes vomiting, diarrhea, fever, fatigue, and soreness. There actually is no treatment for the norovirus. Instead, therapies which target symptoms and as well as fluid replacement will be recommended. Now, you don't necessarily need to have an IV. Usually the doctor will also recommend that you drink either Gatorade or Pedialyte to replenish the fluids that you lose through diarrhea and vomiting. Generally, the virus is very survivable unless you reside in a nursing home due to age and immunocompromised patients. This is important because usually patients in nursing homes already have pre-existing conditions such as diabetes, dementia, or possibly recovering from a stroke, as well as hundreds of other diseases that require them to have 24/7 nursing care. And that actually concludes my presentation. Thank you.